July 14th of last year, 2021, I came down with what I thought were symptoms of a sinus infection. Sinus pressure, congestion, cough, low-grade fever, body aches. And so about 5 days in, wasn't doing a whole lot better. Took my own oxygen saturation at home, and I was 78% on room air. So that's when I decided it was time to go to the emergency room. And got right in and immediately tested me for COVID, tested positive for COVID. And I began a 2-week stay at NCH with high flow oxygen and therapy, intravenous antiviral therapy. Things went south very quickly. So they took me downstairs, did a CT scan, showing me what was left of my lungs. Both of my lungs were destroyed. My wife and myself looked at the scan together, and he said, we only have one choice at this point. He's like, you're not oxygenating. You're requiring near 100% oxygen to keep minimal oxygen saturation. I need to intubate you now. So my two options, as they were laid out to me, were continue with the trach, likely the rest of your life, and require oxygen during the day and a ventilator at night, or have a double lung transplant. I was terrified. I was terrified to be intubated. I didn't want to show that concern to my wife. That's why I made her promise to let me never stop fighting. She said, I promise I won't let you stop fighting. I think that's one of the single most difficult things I've ever had to do, was to be able to tell her maybe for the last time how much I loved her. Dealing with your own mortality is really difficult. I was just turned 50. So I wasn't ready to have that conversation with myself that I might be leaving my wife and my children behind. After I had been on mechanical ventilation for a few weeks, and on Labor Day weekend, they had actually discussed withdrawing care, withdrawing support with my wife because things were not looking good. So my wife is very resourceful. She contacted the medical director of the lung transplant program at Advent Health, essentially. We found someone who was willing to consider me for lung transplant. So I stabilized enough that they could get me in a helicopter, get me to Orlando. I matched for my lung transplant on October 31st and had my transplant on the 1st going into the 2nd. So I've learned a lot from this. It's changed my outlook on life. I also learned that by not letting people help me, I was robbing them of a gift that they wanted to give. So to my care team at NCH, my doctors, my nurse practitioners, my nurses, my therapists, my patient care techs, I just want to give a heartfelt thank you and tell you how much I appreciate the care that I received while I was at NCH, because without that care, I wouldn't be here today.